Can it cure the advanced stages of cancer?
This is what we expect.
What are the new kind of approaches of immunotherapy?
20-25% will work very well, but there are 70-75% patients who may not be in very good control,
Biomarker testing, what it is all about?
which are done either on the cancer cells or even inside the blood.
Can we consider immunotherapy as the beginning of new era of oncology?
It has actually transformed the outcome of cancer patients.
So we have Dr. Bhavesh Poladia with us, and we are going to talk about immunotherapy. So welcome to our podcast series.
Thank you.
Sir, we have heard so much about immunotherapy, how it is considered so revolutionary.
So it is revolutionary in the form of it has changed the scenario. It is changed the way it works for cancer patients. So initially what we had was just chemotherapy.
Right.
And it used to affect both targeted means cancer cells and the normal human cells also. But with immunotherapy, it focuses more on the cancer cells and less on the body normal cells. So this is how it makes the difference. And you can say it is a kind of a targeted therapy which
Right.
targets the cancer cells more and affects the body's normal cells less.
Okay. So why does it work so dramatically for patients?
It is more like a focused therapy and it focuses on the cancer cells alone mainly, and that is how it becomes better than any other kind of therapy what we used to do almost 2 or 3 decades back.
Okay. So if you talk about immunotherapy, can it cure the advanced stages of cancer?
This is what we expect that in
Okay.
future this is what is going to happen, and we can see some signals which are happening right now. So with the use of immunotherapy even in the last stage cancers, there are certain cancers which comes under an excellent control, and a few percentage of them almost we are expecting 20-25% patients as of now in subsite of cancers, they are doing extremely good.
Okay.
And after a couple of years of therapy probably they are deemed cure. But
Okay.
people are working on that all over the globe. Scientists are trying to see whether it is actually working that way, and we are very hopeful that even in near future probably last stage cancers also will be curable. Yeah, probably time is not yet come totally, but yes, this is what we are expecting in future it is going to happen.
So moving forward with my next question, I would love to ask you which kind of cancers gets benefited the most from immunotherapy?
So immunotherapy actually started with cancers of skin like melanoma, and then to the lung cancer, and then to the colon cancer. So these are few of the cancers which are studied well, and we see the results are exceptionally good in this 2-3 subtype of cancer. But there is no subtype of cancer in the entire body which is not getting improved with immunotherapy. If you ask me whether it works for any other site, yes, it works in almost all the sites of cancer, all the different types of cancer. But if you see the top 3, probably melanoma is number 1, followed by lung cancer and then colon cancer. So these are the most beneficial areas where immunotherapy has made a mark. But we see in future we'll see equally good results in other cancers also.
Okay. Sir, I have heard about the term called as biomarker testing. What it is all about?
This is very important because we have to select in some cancers, we have to select which patients are going to get benefited with immunotherapy.
Okay.
So to mark or to biomark it, to understand which are those patients, these are certain tests which are done either on the cancer cells or even sometime inside the blood. So it is
Okay.
just like a simple blood test also which can give us information that these are the patients who are going to do better with immunotherapy.
All right.
But there are certain cancers where biology of the cancer is in such a way that immunotherapy irrespective of biomarker is also going to work.
Okay.
Again, like patients having melanoma, patients with hepatocellular carcinoma, in common language it's a liver cancer, renal cell carcinoma, in common language it is a kidney cancer. So these are some areas of where you do not even require a biomarker because most of them are going to do very good with immunotherapy. At other sites like lung cancer, colon cancer and many other subtypes like breast cancer, we do check whether which are these patients. It is like a check. Okay, if
Right.
this is positive, immunotherapy works better.
Okay. So what are the new kind of approaches of immunotherapy that are emerging?
So we see that immunotherapy in 20-25% will work very, very well, and probably at long term these patients are deemed cure. But again, when we see the flip part of it, there are 70-75% patients who may not be in very good control, and there are certain resistant pathways which are getting developed for the patients who are on immunotherapy.
Okay.
So newer things, when it comes, they are trying to see whether resistant mechanisms can also be targeted. So it is like one step ahead of cancer.
Okay.
And we combine those two kinds of therapy, immunotherapy and those resistant pathway therapy, and then we see the graph or the improvement is going even 40-50%. So across the globe, scientists are working to understand what are the resistant patterns and to be one step ahead of the disease so that we achieve our goals in a better way.
Okay. Sir, can we consider immunotherapy as the beginning of new era of oncology?
Yeah, definitely, because this has changed the scenario what we used to struggle with just chemotherapy in our hand to tackle cancer in almost last 3 to 4 decades, and in last 1.5 decade it has actually transformed the outcome of cancer patients. So initially we were struggling even with first, second, third stage cancer. With chemotherapy it became little better. Now even we are when see a stage 4 cancer, we try to see that okay, this patients should have a long term control, and probably in a certain percentage of patient maybe even cure. So we are not now worried that even if the patient is having stage 4 cancer and it's a death sentence. So this was something what we used to think almost 2 decades, 3 decades back, but this is no more true. Now even if the patient is diagnosed in a late stage, they have avenues to go ahead and have a good outcome with the perfect treatment.
So my questions are now over. Is there anything additional that you would like to add?
Most of the things when we speak about immunotherapy, important sometimes is to understand how it works. So it activates patient's own immunity. So in general, what is immunity? Immunity basically detects anything which is foreign to body. So it can be even bacteria, fungus, virus, even a foreign body, and including cancer. Immunity actually identifies it and eliminates it. So that is what is the work of immunity, to keep the body healthy.
Right.
But cancer is a little smart person. So I think you must have heard about invisibility cloak in Harry Potter. So that is what it does. So cancer puts an invisibility cloak on itself, roams around the body, proliferates, multiplies, and the immunity is not able to detect it. So this is where immunotherapy comes into action. Immunotherapy removes that invisibility cloak, exposes the cancer cells and attacks them. So that is why it becomes a more targeted therapy and more effective therapy. And in fact, even after you stop the therapy, the change which has happened inside the body or improvement in the immunity which has happened, that stays for long for that patients. And that is how we expect that these patients are going to be cured from their cancers.
Wow. Thank you so much for sharing all your insights with us, sir. Is there any final message that would you like to give to our audience?
So definitely, I would, more than a message, I would like to give a summary that number one, do not be afraid of cancer. Even if it is in the last stage, there are avenues and there are treatments which are going to minimum cure, and even there is a possibility of a good control. So cure for few percentage, maybe this percentage is going to increase in future, and control definitely. So it's not a death sentence anymore, and things have changed a lot in last 1.5 decade, and more affordable, especially when you are in India. You are very, very lucky to have everything which is available in the world. And also the additional point is there are many Indian companies which are coming out with new therapies, including immunotherapy, and making it very, very affordable for common people also. So don't be worried, go ahead, meet your doctor, discuss with them, and I am very, very sure that you are going to get a good outcome of your patients.
Thank you. Thank you very much, sir, for sharing your expertise and your experience with us. Thank you. Thanks
Thank you
a
so
lot.
much.